are in Calgary, and so we are living, working, and playing on the traditional territories of the Blackfoot Confederacy, so the Siksika, Kainai, and Piikani, as well as the Tsuut'ina and the Stoney Nakoda nations, as well as Métis Nation Region 3, and all those who are making their homes in the Treaty 7 region of Southern Alberta. We just want to take the opportunity to acknowledge our relationship, of course, with the land that we are working and living on, as well as our relationships with one another as we move towards peaceful reconciliation. For our speaking series this evening, as mentioned, we are focusing on lymphedema and exercise, and in particular, outlining some of the evidence that is behind exercise after cancer diagnoses, as well as the role of exercise management of lymphedema in particular. We're going to be reviewing some of the key home exercises for you all today, as well as some of the changes we can make for our daily routines in implementing exercise. So with that, I'd like to introduce our two speakers. So first off, I'll introduce Dr. Capozzi, who is a resident physician in the physical medicine and rehabilitation program at the University of Calgary, and also who has her PhD in health and exercise psychology. She's also a clinical exercise physiologist and co-founder of the Thrive Health, an innovative exercise company specializing in the training of fitness professionals. Lorena has a special interest in cancer rehabilitation and has dedicated her career to research and innovation to improve the function and quality of life of those facing cancer. Throughout her PhD in medical training, Lorena has been nationally recognized for her work in cancer rehab and exercise. She's co-founded Canada's first student-run fitness center for cancer survivors, the Thrive Center, and was honored in Avenue Calgary's class of 2015 Top 40 Under 40. She is active in medical education and played a key role in the development of national physical activity in medical curriculum objectives and physical activity as medicine curriculum for undergraduate medical students at the Cummings School of Medicine. And I can attest to how great that has been as a med student myself. As an exercise physiologist, Lorena has vast experience facilitating community exercise classes. And in 2017, she was one of 17 medical students from across Canada selected for the Canadian Medical Hall of Fame Award. So we're very excited to have you tonight, Dr. Capozzi. Thank you again for joining us. And I'll also introduce Ms. Julia Daun as well, who is a wellness advocate, world traveler, and visionary. Julia's passion is to promote health and wellness for both healthy populations and those living with and beyond cancer. Collectively, she has over 12 years of teaching and leadership experience, as well as over 8 years specializing in exercise oncology. Julia is currently a PhD candidate and CSEP clinical exercise physiologist in the Faculty of Kinesiology at the University of Calgary, working with Dr. Nicole Coulis-Reed. Her research is examining the role of exercise for individuals living with and beyond brain cancer. Julia is committed to promoting patient-oriented research practices and moving evidence into practice. She's been awarded numerous accolades at local, provincial, and national levels to support her research. Outside of academia, Julia enjoys traveling, being outdoors, and taking pictures. Having traveled to all 7 continents and 42 countries, wow. Julia has established an understanding and appreciation of various cultures. With her international collaborations and research experiences combined, she has developed a comprehensive understanding and appreciation of various cultures, and as such, has cultivated a multimodal approach to health promotion that addresses equity, diversity, and inclusion. So once again, very excited to introduce our two speakers for this evening. I'll let you both take it away from here.
Wonderful. Thank you, Catherine and Diane. It is our pleasure to be here today and presenting to all of you. I know you're tuning in, I'm not sure, from across Calgary or across different provinces. So thank you for taking the time, no matter what time it is. And it's just wonderful to see. I think there's individuals who have been affected by lymphedema and also healthcare practitioners online. I recognize a couple names, so it's just wonderful to be here with you tonight. And thank you for the lovely introductions. As Catherine pointed out, I do have, my disclosure is I'm a co-founder of a company where we train fitness professionals to work with individuals who have had a diagnosis of cancer. And then through this company, we also offer lots of free resources for patients. So I will give you links to that later so you can download a lot of the resources that we have to help you get started with movement and implementing exercise, because that's our big goal for tonight. And I was going to do a little introduction for Julia, but Catherine did a beautiful introduction. So I'm really happy to co-present with Julia Daun tonight. She's a fantastic exercise physiologist and PhD candidate, and she's going to be leading some of the exercise that we're doing tonight, and I'll be giving some modifications to show you that you really can do it from your office desk, because I'm going to be doing it with my blouse on for my office desk, and Julia's going to be doing it from her gym. And so how tonight will run, we're going to spend, we've just done our introductions, we're going to spend the first 20 minutes or so going through the evidence. So we're going to talk about exercise following a cancer diagnosis. I do recognize that some of you may be tuning in who have lymphedema from other causes, not from cancer. And so I apologize that our bias tonight is going to be discussing mainly cancer and lymphedema after a cancer diagnosis. But then we will talk about the role of exercise for the management of lymphedema as well. And then we're going to review some key home exercises that you can do. And finally, we'll finish off by discussing behavior change. And really a lot of research that we do in our lab is not just on the role of exercise for individuals after a diagnosis of cancer, but also how do we help people start exercising and stick with exercise. And so we're going to talk about evidence-based strategies for that. And then we'll have a few minutes at the end where we can wrap up and have discussion. So let's get started, and we're going to talk about the power of movement. And I would say if there's one thing I hope you leave tonight with, it's feeling the ability to move your body just a little bit more than when you started tonight. And so in your next week, looking forward, I hope you feel a little bit of inspiration from tonight so that you can add a couple more minutes of movement in your week looking forward. It's perfect that this is on a Monday, because we're going to set up our week to add a little bit more exercise in. So as many of you may know, cancer is one of our leading chronic diseases in Canada and across the world. In 2020, over 225,000 people were diagnosed with cancer. And on average, in a day, approximately 617 individuals are diagnosed with cancer. Cancer is a disease of age. So if we look at people over time, about 1 in 2 individuals in Canada will be diagnosed with cancer. It's almost 1 in 2 men, and about 1 in 2.5 women will have a diagnosis of cancer. Cancer is usually, like we talked about, a diagnosis of age. So you can see as we age, here's the different age categories here. As we age, the incidence of cancer increases, or the prevalence increases over time. But when we look at age 12 and up across Canada, approximately 7% of people are living after a cancer diagnosis or living with a cancer diagnosis in Canada. Now, we have a great problem on our hands in the sense that between the years of 1940 and 2014, our 5-year survival rate skyrocketed. So this is an amalgamation of all cancer types. This doesn't speak to your cancer type per se. You may have a very different range of survival rates for your cancer type. But if we take all cancer types together, we see that back in 1940, about 25% of people at 5 years would survive, and now over 65% of people. So huge increase, and that's because we do a better job of screening, we do a better job of identifying, and we do a better job of treating cancers. But what we need to work on is doing a better job of rehabilitation after, because that means lots of individuals are living long lives with the side effects of their cancer and treatments. And one of those is lymphedema. And so how do we do a better job of helping individuals with physical rehabilitation, psychosocial rehabilitation, so that people can live well way beyond their years after a diagnosis of cancer? So Dr. Carrie Cornier and Christine Friedenrich, both from Alberta. Dr. Friedenrich's here in Calgary, and Dr. Cornier is in Edmonton, and they are some of the leading researchers in the world. And I would say in Alberta, we are leading in the world in terms of our research with exercise and cancer. And they published this 15 years ago. This was a model that looked at the role of exercise across an individual's lifetime after a diagnosis. And so this is pre-diagnosis. And then here an individual has a diagnosis of cancer. This is pre-treatment, so they haven't undergone any treatment yet. And then we go into treatment and survivorship. Some people may go on to palliation and end of life care. Some people may go on for survival. And so what we found over the last 15 years since this has been published is there is an important role of exercise all throughout this. So we now have evidence on the role of prehabilitation studies, so getting people active before they start treatment and the huge benefit this can have on improved surgery outcomes and improved outcomes for quality of life and functioning. We have really good evidence on the restorative principles and benefit of exercise after someone has undergone treatment or during treatment. We do see that people who exercise during treatment actually have reduced risk of developing lots of different side effects from treatment, like fatigue and pain. We see that into survivorship, exercise helps with supportive management for ongoing symptoms and side effects like lymphedema, which we'll talk about. And then individuals who have non-curative cancer, we see that there's a big role for exercise in helping with quality of life at the end of life as well. Now, I'm in my residency training for physical medicine and rehabilitation, or physiatry. And so I thought most people think, what the heck is physiatry? I've never heard of this before. So I wanted to talk a little bit about cancer physiatry. In Canada, we currently have 5 fellowship trained cancer physiatrists. So it's not very common of a specialty, but it's a wonderful one. And so after my training, I'll go on to do a fellowship and become a cancer physiatrist is my goal. And these are the kind of things that rehab doctors, cancer rehab doctors, or cancer physiatrists treat. And one of the big things is lymphedema. So these are lots of different conditions that we can see individuals face after the diagnosis of cancer or after their treatments. And so these are some of the things that we'll treat as a physician with an expertise in cancer rehabilitation. We do have one in Calgary. There's now one in Winnipeg. There's 2 in Toronto, and then there's one in not Halifax, but another one in Ontario, and I'm blanking on where she is. It'll come to me in a moment. But so we have 5 kind of distributed across Canada currently. And then there's other physiatrists who do some cancer work as well in different provinces too. So back to exercise. So this is a review that was published in 2017. So it's 5 years old now. And when we look at the level of evidence, so we have studies done on 1 or 2 people, and then we have bigger studies where we follow people over time, and then we have bigger studies where we randomize people into different groups and we can compare the outcomes of those different groups. And then we have reviews that look at those randomized control trials and summarize the data. And then we have reviews where we collect all the data in those studies and pool them together. And those reviews at the top are the best evidence that we have. And so this is one of those publications. So this is a publication from 2017 where they looked at 51 systematic reviews. So this study looked at 51 reviews of many different randomized controlled trials. And this was all to do with exercise in cancer. And they found exercise is beneficial before, during, and after cancer. That the best type of exercise to get health benefit is at a moderate to vigorous intensity. And we're going to actually work on that today and talk about what moderate intensity means. That exercise is beneficial to manage treatment-related side effects and may even enhance the tolerance to cancer treatments and improve functional outcomes, which is, I gave the example of that earlier. That supervised exercise yields superior results versus unsupervised. So that accountability is a huge piece. And that serious adverse effects are very uncommon. So the benefit of exercise outweighs the risks of becoming more active, hugely outweighs the risks. And I love to think about this analogy. I've been giving talks like this probably for the last 15 years. And I really love to think about this analogy of a tug of war. And we tend to see that cancer and its treatments can negatively affect all of these things on the left: body composition, weight management, fatigue, sleep management, cardiovascular fitness, bone strength, muscle loss of appetite, depression, anxiety, pain, hormone regulation, quality of life, function, and survival. And it can feel really, individuals often tell me they feel out of control because often things are done to them. They don't feel that control over this journey. And exercise is something where you grab onto the other side of that tug of war rope and you pull back, and we see all these positive benefits. So that study summarized all these benefits that we see when individuals are active in exercise, and it pulls back on all of those different components there. Now, in the last, I used to say 5 years, but really in the last 10 years now, we're starting to see a lot new studies published where we look at survival. And so these studies take a long time to do because they randomize individuals into two groups. One group exercises for many years, one group doesn't. And then they watch over time in terms of survival rates of these different cancer types, or these different individuals with different types of cancer. And now what we're seeing as these publications are coming out is individuals who meet the Canadian or the cancer exercise guidelines actually have decreased mortality rates. So you can see here's the line in the middle where it doesn't make a difference. And overall, we see that there's a decreased mortality rate of individuals who are active and who exercise. So that really tells us now that exercise not only helps with our physical function and our psychosocial function, but we need to be exercising. It's a type of treatment to help us with survival. So this is exciting work and means a lot of more money, lots more money comes into doing these studies. So overall, you may have heard different exercise guidelines. So our Canadian exercise guidelines are 150 minutes per week of moderate intensity aerobic exercise, cardiovascular exercise, plus do 2 days of resistance training. So that's about 5 days a week of 30 minutes of aerobic exercise plus 2 days of resistance training. And that's what our cancer exercise guidelines used to be until 2019. And in 2019, Campbell and colleagues did a big study and review where they looked at all the cancer exercise literature and actually found that a lower dose of exercise has substantial number of benefits associated with it. So they changed the guidelines. And so now we recommend 90 minutes of moderate intensity aerobic exercise to get that benefit. More is always, in most cases, better. So 150 minutes is excellent. But really, we see people who do 30 minutes 3 times a week of aerobic exercise plus 2 days of strength training get the benefits that I just spoke about. So that's really exciting and also a bit more approachable if you're just starting to be active. The other things they discussed are these 3 points here. So exercise is safe and feasible during treatment. It improves physical function, fatigue, and quality of life. And we want to avoid inactivity and return to daily activity as soon as possible following a diagnosis. So years and years ago, you're going to hear me say this again when we talk about lymphedema and exercise. Years and years ago, we used to think you go home and rest and you don't do anything, don't be active. We know that is not the healthiest thing for your body and not the health. You don't get the most health benefit from that. You get the most health benefit when you return to activity more quickly. After treatment, exercise is essential for recovery and fitness. So improve some of the physical side effects and lots of evidence for other types of improvements that we're finding, and enhances overall well-being and quality of life. And the last point that we're going to talk about is individualization and tailoring are necessary. So those general guidelines are great, 90 minutes, but it doesn't really help us tell what should a breast cancer patient do for exercise versus a head and neck cancer patient versus a prostate cancer patient. And they all face very different side effects, very different changes in their physical function. And so they should probably be doing a bit of different types of exercise. And so now we're starting to get better at tailoring exercise based on needs. And we're going to talk about this today when it comes to lymphedema. So this is a paper that we published last year, and it was specific to individuals living with advanced cancer, but actually we address many things that don't apply to or many conditions that apply beyond advanced cancer. So individuals living without advanced cancer, curative type cancers. But I bring this paper up because I know there's a few healthcare providers or fitness professionals potentially online tonight. And I'll provide the link to this paper at the end as well. But you can just see this is a bit of a video. So lymphedema is down here. We talk about a description and how to adapt exercise. And we go over 29 different side effects or different clinical issues that individuals may face and how you would tailor exercise based on that. And this summarizes the latest evidence. And so this is a paper you can download. It's open access, and it allows you to go through and really see if you're working with an individual, how would you tailor exercise for that individual. So it just gives you an idea of a table there. Sorry, my dog is making noises in the room if you can see her. So this is just an example here of lymphedema, and we'll actually talk about some of these points so you can see what we write in this paper. So let's get to the meat of tonight. I know that you're interested in hearing about exercise and lymphedema, and I actually had fun going over this again. I'm not an expert in lymphedema. I'm not a lymphedema specialist per se. I am involved in the new guidelines being developed for breast cancer and lymphedema, led by Dr. Margie McNeely out of Edmonton. And I'm also involved in a new systematic review that we're looking at for head and neck cancer patients and lymphedema treatment. That's a number of physiatrists from around the world, or rehab doctors from around the world. So I'm interested in this area, definitely, and I've been reviewing a lot of the evidence in this area for these different projects. But I know there's maybe lymphedema specialists online who probably have much more expertise than I in the day-to-day management of lymphedema. So that's my little disclaimer. Now, all of you could tell me this. I don't think you need a definition for what lymphedema is, but in case we have individuals who are new, so really a disruption in the lymphatic system that prevents adequate drainage from the lymphatic vessels, causing protein-rich fluid to accumulate in the interstitial space. And this can be following in a cancer setting. It can be following axillary, cervical, or groin node dissection or disruption, as well as other node dissection or disruption around the body. And disruption can be from other types of treatments, as you're likely aware, radiation treatment, for example. And so most people will present with limb tightness, heaviness, fullness, pain, impaired limb function, or decreased quality of life and function. And really, we have the reduction type therapy. So that is, many of you will do decongestive type therapies, manual lymph drainage, compression garments to control edema, and then maintenance type therapy as well. And so exercise is one of those that we're going to talk about today. So I talked about how, years and years ago, we used to treat individuals after a cancer diagnosis and say, go home and rest and don't do anything. And now we learned that actually increases their rate of heart attacks and doesn't help them recover. And that's not a good thing. And being active is much better for overall recovery, getting back to life, and getting back to your day-to-day function. And lo and behold, look at, we have similar literature in terms of exercise for individuals with lymphedema. So 20 years ago, we had little evidence available to support the role of exercise for lymphedema management. We didn't know. So the old recommendations urged individuals to avoid activities that could overload or restrict the lymphatic system and to use caution when participating in specific physical activities. So if I was in person with all of you today, I would ask you to put your hand up and tell me if you've heard of this before, or if you're concerned about this because you've read this before. And I wonder if a few people would maybe raise their hands and say, I have heard this, I've read this in past literature, or I've read this in past recommendations. And so this is old, and we're going to talk about the new. So in the past 20 years, it's a lot of time, evidence has changed. So we now know that participating in exercise actually improves function, quality of life, reduces treatment-related morbidity, and improves survival for individuals with cancer. And exercise at a moderate or high load is considered safe for those living with lymphedema or those at risk for lymphedema. And it has not been shown to cause or worsen lymphedema. And this is from a latest review published in 2020. I'm going to talk about 2 review papers that were published in the last 2 years. So this was a systematic review published and meta-analysis. So meta-analysis is where they actually pool the data from multiple studies and reanalyze it with more numbers of people. So it gives you even better reporting data. And so this was published in 2020, 2 years ago, and they included 29 studies. And what they found, so this is breast cancer specific, breast cancer related lymphedema. There was a significant reduction in breast cancer related lymphedema after resistance exercise. And this was seen on bioimpedance spectroscopy. So when they actually look at the volume, there was significantly improved. So what's excellent about these studies is we actually see that these individuals trained enough with a high enough load that they actually improve their muscular strength in the upper and lower extremity. So if you do enough resistance training, you need to have enough of a load to improve your strength over time. That's what they did. And they improved their strength over time. And while doing that, we saw that their lymphedema did not worsen. And in fact, there was some improvements in lymphedema management. And so the conclusion was overall resistance exercise does not have a systemic negative effect on breast cancer-related lymphedema, and instead potentially decreases it. Now, this is another review, and this was published in 2016, so a little bit older. They included 21 exercise and 4 compression and exercise studies. And then they summarized all of these and again, summarized them and then also pooled the data for the studies that they could pool. And individuals with lymphedema, they talked about how they can safely participate in progressive regular exercise without experiencing a worsening of lymphedema or related symptoms. And one thing that they looked at that there wasn't sufficient evidence for is whether or not individuals should wear compression garments during exercise or not. And so interestingly, they didn't find that there was sufficient data to say yes or no. In some individuals that were included in these studies, they found there was improved management wearing a compression garment. Other individuals felt that it restricted their range of motion doing exercise and that it caused more of an increased demand on their cardiovascular system and really didn't make a difference if they had it on or not in terms of their lymphedema management. So to date, we don't have a good enough evidence to say that wearing it versus not wearing it during exercise, when we look at a population or a big study, makes a difference. Now, that being said, if you work with a lymphedema specialist and they've encouraged you to wear your compression garment during exercise, that's what you should do because tailored approach is best and they know you best. But just interesting to look through this study and see that that's what the results were. And so overall, when you look through multiple reviews, we see that exercise actually helps manage lymph swelling by improving lymph drainage. So imagine a very simple, your muscles, when they pump that lymph fluid back into the central circulatory system. And so, I don't know why it took us years and years to come up with this, but when you're pumping your muscles, you are helping with that pumping system. So it makes sense that physiologically, this helps to relieve that fluid. Studies comparing high load resistance and low load found improvements in both groups with no differences in affected arm swelling. So this is quite interesting because often, initially maybe 15 years ago or 10 years ago, we said, yes, it's safe, but only use light weights. I remember teaching exercise classes 10 years ago and talking about that. And now over time, we see that you need to use an appropriate weight for your strength. But as your strength improves, you can increase your weight and we don't see that there's a worsening in your lymphedema management. But still start low and then progress slowly. And so if you look through that paper I talked about, here were the final recommendations. So that paper was written with a number of cancer physiatrists from around the world and physicians, as well as exercise physiologists. And so our conclusion was, obtain physician consent prior to exercise if there's any change in limb volume or patient complaint of subjective limb heaviness. You can continue to do activity at current levels as long as it does not worsen symptoms and then progress as instructed or as you can tolerate. Stop exercise if you develop cellulitis, so an infection in the skin, lymphorrhea, so you start to have that oozing of lymph fluid, or subcutaneous infection signs and symptoms are noted. So that's one thing that's really important to keep in mind. Ensure ongoing treatment of lymphedema by a certified lymphedema therapist with complete decongestive therapy while you're on an exercise program, if that's part of what your therapy program entails. And then we just recommend continuous skincare, manual lymph drainage strategies, positional approaches, and use of compression garments when applicable when exercising. So hopefully that was a brief but good little summary to get you warmed up and get you eager to start moving. If you have questions, jot them down. We're going to have time at the end to go through and discuss this in more detail. but you've heard me talk for almost 25 minutes, so let's get up and get moving. And Julia's going to take over. We're going to do about 10 or 15 minutes of activity. And I'm going to participate from my office, and Julie's going to participate from her gym. And we just hope you enjoy. A couple things that we will say before we start. So we love this rated perceived exertion scale. This is to help you identify how hard you're working. So 0 is nothing at all. You're laying in bed, you're doing nothing. 10, a bear is chasing you in Banff. You're running as fast as you humanly can. You're working as hard as possible, okay? We don't want you there, and we don't want you at 0 either. Where we want you to be is about moderate and somewhat hard. Tonight, we'll probably be at moderate. So this is if you were out for a nice evening walk and you start to pick up the pace a little bit, and every now and then you need to take a little bit of a breath to catch your breath, but you can still maintain a conversation. That's moderate. That's where we have our evidence that shows the benefit of exercise. And then as you get harder, you have to take a little bit more breaks to breathe, but you can continue for a period of time, up to 45 or 60 minutes potentially if you're working hard. Very, very hard. This is where we get into short bouts of high intensity exercise. So we're going to be hanging out around 3 today, maybe even lighter because we're not doing a lot of aerobic exercise, but this just gives you an idea of where to work. And the other thing I love to do, and we've done lots of studies where we use these thermometers and we actually measure individuals' fatigue and energy before class, and then we measure it after class. And research shows over and over again, because fatigue is the biggest barrier to being active that many individuals face, but exercise decreases fatigue rates. And so this is a neat tool that you can use for yourself if you're feeling really tired. Use this tool. Maybe you're rating yourself fatigue of 7. Do a little bit of activity, see where you fall after your exercise session, okay? So should we get started, Julia?
Let's do it. Thank you, Lorraine. Can everybody hear me okay now that I'm connected to my headphones? I see one feedback from Lorraine. Perfect. And hopefully everybody can see both of us on the screen. We are going to get moving now. I have 2 housekeeping items. The first one is listen to your body first, my voice second. We're going to show you a few example exercises for what you can do to warm up your body, a few example exercises that you can do from the comfort of your home, when you're watching TV, when you're out doing grocery shopping even, and then a few stretches that you can do as well. So this is just a teaser of a few exercises you can do. If you are feeling quite energized tonight, I know it's 7:30 on a Monday, you can follow me. I'm going to be showing some higher intensity standing options. If you're feeling a little bit more fatigued today, you can watch Lorraine. She's going to be showing some lower intensity seated option exercises. So let's get started. Come up to standing. We're going to get started with a few warm-up moves. I want us to all take 3 big shoulder rolls. So bringing your shoulders to your ears, dropping them down. Do 1 more big one, opening up through that chest, letting the day go. 1 more big one. And when you're ready, we're going to start walking side to side, a little step touch. So I'm going to show you 5 warm-up moves. The purpose of a warm-up is to get our body moving, get the blood flowing, get our heart to start pumping blood to our working muscles, loosen up our connective tissue, and also mentally prepare for the movement ahead. So we can check in with ourselves. We can think about what we want the next 30, 60, 10 minutes to look like, and warm up our movement pattern. From here, we're going to take it up to bump kicks in 3, 2, 1. We're going to open up through the front side of our body now. So opening up through the chest, through our quads, the big 4 muscles in the front of our thighs here. If you're feeling energetic, you can add a little bit of a bounce here. If you're a little tired, you can take out the arm movements, take out the bounce. Awesome, awesome. Okay, let's do 5 more seconds here. That's 3, 2, 1, and we're going to take it to some high knees. Opposite hand, opposite knee. If you're a golfer or a mini golfer, you can imagine snapping a golf club over those knees. Again, if you're feeling tired, you can take out the arm movement and do just the legs like Lorraine is showing. And throughout all of these exercises, thinking about keeping your chest high and proud, your belly button pulled to your spine, and moving with your breath. I'm going to talk more about that in a second. Let's do 3 more here. That's 2, 1, and let's take it to a hip hinge. So feet about hip distance apart. On your inhale, you're going to send your bum back, chest stays high and proud, nice flat back. Exhale, pushing the hips forward, squeezing your bum on the way there. So as we're coming back, inhaling, exhaling to bring us up. This is a movement coming through our hips, not through our back. So if you're starting to feel this in your upper back or even your low back, see if you can roll those shoulders down and have the movement come from your hips instead. Kind of like you're trying to hit a wall that's behind you. If you're feeling tired, you can make this a little bit of a smaller movement. And if you're feeling good, maybe a little bit bigger. Awesome. Let's do 5 more seconds here. This is a really good warm-up move because a lot of what we do in our day-to-day life requires us to hinge through our hips. So it's a good movement pattern to warm up. 3, 2, 1. Let's go into some arm circles. So here, either 2 at a time or 1 at a time. And you can either bend or keep the arms straight. Let's do 3 to 5 big arm circles backwards just to open up through that posture, open up through that upper body. Your range of motion might look different than my range of motion. So just choosing whatever version of this that feels good for you. Awesome. Nice. Let's do 3 more. 2. And last one. Let's finish with a little cardio. A little 2 in, 2 out. So we step 2 to the inside, 2 to the outside. We're working our mind and our body here. And that's what we're always doing in exercise. We're making those mind to muscle connections. Here, if you want, you can add a little bit of speed, a little bit of a jump, or you can keep it lower and slower like Loren is showing. Beautiful. Let's do 5 more seconds here. Excellent. 3, 2, 1, and let it go. Hopefully you're feeling a little bit warmer now. Loren, are you feeling warm? Okay, excellent. So now keep those legs moving. You're going to find your chair. If you're following me, actually, if you're following both of us, we're going to start seated. We're going to come to the edge of our chair and we're going to give ourselves a nice shoulder roll down and back from those ears. Pull our belly button to our spine. We want to be sitting up nice and tall. So finding that nice posture here as opposed to leaning into our chair. If you're following me, hands can cross over the shoulders in front, or they can come to your hips, feet about hip distance apart. On that exhale, you're going to come up to standing, extending through your legs, squeezing your bum on the way up. Inhale takes you back down. Exhale brings you up. Inhale back down. If you're following Loren, you're going to stay seated in that beautiful posture. And on your exhale, you're going to do this with your puppy if you have one at home. You're going to extend that foot in front, squeezing the top of your leg. You decide how far you go with this. So you don't have to bring that leg all the way up really high. And same on the squat. If it feels better, you don't have to quite touch that chair. In your sit to stand, your weight is in your heels. Your back stays nice and flat. You're sending your bum back. Beautiful. Let's do 2 more reps here together. Awesome. This one's so good for doing when you're watching TV at a commercial break or when you're waiting for your coffee to brew in the morning. Okay, good. Hopefully the lower body's warmed up now. I'm going to show you one more lower body movement. You're going to want to keep onto that chair, or you can have a wall nice and close to you. We just worked the front side of our legs. If you were on a sit to stand, you may have gotten some glute or bum activation as well. Now we're going to focus on the back side of our legs, so our hamstrings and lots of bum action here. So either option, whether you're following Loren or me here, we're going to square our hips and our chest to the direction you're facing. And we're going to focus on doing a hip hinge like we did on our warm up, but now one leg at a time. Now, if you're following me, we're planting one leg on the ground, keeping a slight bend in that knee, hinging forward, chest stays high and proud, back stays nice and straight. That back leg can either be straight or bent, you decide, and you decide how far you go. If you're watching Loren, you can see she's doing that same movement, but she's planting that back leg to support her balance. This is one of my favorite exercises because you're working on lengthening. Yes, switch sides. We better do that so we're not feeling lopsided tomorrow. You're lengthening your hamstrings, so the muscles in the back of your leg on the way down, and then you're engaging them as well as your buttocks muscles on the way up. You're also working on coordination and balance. It's a fantastic exercise. Let's do 2 more reps here. Good. Always moving with our breath. So inhaling as we set ourselves up or as we come up, and exhaling at the harder part of the exercise. Okay, we're gonna move on to some upper body movements now. You're gonna wanna find that wall, and we're gonna work through a push-up together. So here, you want to make sure your hands are stacked under your elbows, and your elbows are stacked under your shoulders, just out in front of you at the wall. For an added challenge, you can take a bit of a step further away. From here, on our inhale, we're gonna come towards the wall while keeping a nice line from our head to our bum. Inhaling brings us there. Exhaling brings us back up. Belly button is pulled to the spine, and our elbows come out at a bit of a 45-degree angle. You can decide what that angle looks like. If you go a little bit one way or the other, it's okay. And for an added challenge, you can go a little bit deeper, or you can keep it a little bit more shallow, moving your body as one unit in and out of the wall. Excellent. Let's do 1 more rep. Perfect. Beautiful. Okay, give yourself a little shoulder roll here. The shoulders love to creep up when we do push-ups. And we're going to do another upper body exercise. It's called our wall or air angel. So if you're following Loren, you're going to find that seated position again, and you're going to find that nice tall posture again. If you're following me against the wall, you're going to bring your head, shoulders, and bum against the wall. Our hands are going to come into this angel position. Whether they touch the wall or not, doesn't matter. You decide what feels best for you. And then 1 or 2 hands at a time. On our inhale, we draw the arms up, overhead, exhale, down towards our core. If you're doing this one off the wall, same thing applies. You just bring your arms back as far as feels comfortable. And if one arm is a little bit stiffer than the other, you can always try 1 at a time. Our palms are facing forwards. And again, we're moving with our breath. Inhale brings us up. Exhale brings us down, squeezing between the shoulder blades. This is a great exercise for our range of motion. So our mobility, to stabilize and strengthen our shoulder blades, and to really open up our posture. So this is great after a day of sitting at our desk or computer or watching Netflix. Let's do 1 more rep here. Fantastic. Excellent. And smiling helps. It's physiologically proven, right, Loren? You learn it in med school. You smile with your exercise, it makes it easier. Okay, 1 more exercise we're going to do together is a core exercise. It's a plank. So you're going to find your wall again. There's 2 options. The first option, Loren is going to show from her forearms on this plank. The other option is from your wrists. Now, if you're going with your forearms, you want to make sure your elbow is stacked under your wrist and your elbow in line with that shoulder. You take a step away from the wall, and now you're making a nice straight line from your head to your toes. You're squeezing your bum, shoulders down and back from those ears, belly button pulled to your spine, and you're working your core. Your core is everything from your hips up to your shoulder blades. So it's not just the cheese grater as we used to learn 20 years ago, but it's everything from the front to the back of our spine, our glutes, which support our spine, and then our posture, our shoulders help us there. Another option here is you can take the same movement from your wrists. So instead of being on our forearms, we come up to that push-up position, and you can either hold there or you can add a gentle shoulder tap. So opposite arm to opposite shoulder, trying to keep as stable as you can through your core. So oftentimes this movement, it's gonna try to force us to let go of our core here. Your job is to keep them square, your shoulders and hips square to the direction you're facing, exhaling as you tap opposite hand, opposite shoulder. Let's do 1 more rep here and letting that go. Give yourself a shoulder roll. That's our 5 exercises for you. And with any component of physical activity and exercise, it's also important to stretch your body. So stretching allows you to keep a healthy range of motion, keeps our joints healthy and happy, and prevents us from getting injured as well. So we have a couple stretches to show you. starting with a quad stretch. So to stretch the strong 4 muscles in the front of your thigh, option 1 is you can reach for behind your foot here, grabbing your shoelaces, pant leg, sock, wherever you can reach, or using a band, a scarf, a blanket to loop underneath your foot, grabbing from there. Option 2 is to find a chair like Lorraine is showing and placing your foot on that chair, leaning a little bit forward to stretch the front of the thigh as Lorraine is showing you. It's a bit of a balance challenge exercise here as well. And with any stretch, we're just showing you a teaser today, but you want to stretch for about 30 seconds or so per stretch, just to allow you to relax into the stretch and make sure that you can feel the benefits of that movement. Let's switch side here to find a quad stretch on the other leg. And it's really important when we're stretching, and actually most exercises, it's very common to hold our breath. We're concentrating on a number of different cues, a number of different components of that exercise, and we start to stiffen up and hold our breath. In stretching and in any exercise, you want to move with your breath. And if you're holding something like a stretch like this, think about nice and inhale through the nose, our mouth is comfortable. Inhaling as we inhale, inhaling as we inhale, lengthening as we inhale, exhaling, deepening the stretch a little bit. Let's let that go. We worked the back of our legs as well, so we want to make sure we get a hamstring stretch. Option 1 is you plant your heel in front of you. I'm going to lower my camera a tad. Planting our heel, toe points to the sky. You can hold on for balance. Bum goes back. You're feeling that stretch in the whole back of the leg. Lorraine is showing that option from seated. You're doing the same thing, planting the heel in front of you, toe points to the sky. You're feeling that stretch in the whole back of the leg. An option to reach for that toe. You don't have to touch it. That's just the direction you're headed. You want to keep a nice flat back while you're there. And again, using your breath, let's switch sides as you relax into the stretch. Perfect. So in our warm up, we did a few kind of dynamic stretches as well. So here we're doing a static stretch where we're not moving. In our warm up, we were doing a stretch combined with a movement. And what research has shown is that when we do a dynamic stretch before we exercise, it tends to have better outcomes for how we prepare for that movement. And static stretches like we're doing now are typically best on a warm muscle. Next stretch is a figure 4. I love this one if you're short for time, because it targets a really important part of our body, our hips and the sides of our glutes. So we're going to cross one foot over the quad of the other leg, so over the thigh above the knee of the other leg. So either standing like I'm showing or seated like Lorraine is showing. Standing gives you a bit of a balance challenge. To add a bit of more of a stretch, you can sit a bit deeper if you're standing or lean a little bit forward if you're sitting. And in either option, you can add a gentle sway side to side if that feels nice, or you can just hold where you are. All options are great. Let's switch sides. Opposite leg comes up over that thigh, above our knee. We don't want to be pressing right on that knee. Just above is great. And one side might feel a little different than the other, might be a little tighter, might be a little looser. So just adjusting accordingly. Maybe one side you can stretch a bit further, and being patient with your body throughout all of these. Excellent. Last 2 stretches are for the upper body. From here, we're going to interlace our fingers together, push the palms away from the chest. And here you can also gently round through the spine if you want. The one time we say it's okay to gently round through the spine is here. Otherwise, you always hear us talking about keeping a nice neutral back. And if it feels good, you can play around with moving the arms left and right, ever so gently, always moving nice and slow on with your breath. Maybe ending back in the center. Good, letting those arms come down. And last stretch, crossing the right arm over the chest, grabbing above or below the elbow, whatever feels more comfortable. You can also bend that arm if it feels better. And we're going to be stretching into that upper arm, shoulder area here. On our inhale, we're lengthening. Exhale, pulling that shoulder down and back away from the ear. Maybe giving your fingers a little wiggle or a little shake here. Good, and let's switch sides. Left arm comes up and over. So the beauty of all of these exercises is that you can do them anywhere. When you're watching TV, when you're working, at the gas station, if you're pumping gas and you need a little balance break, you can do one of those. Wherever you are, these exercises are great to do. And I know sometimes it might feel silly if no one else is doing this around, but I've tested this out before. If you're the first one to start doing a little arm stretch while you're waiting for your next appointment, sometimes others join in, and then it's a fun social support activity. So that's what we have for you today, a little teaser of example exercises you can do from home. And I'm going to turn it back over to Loren.
Fantastic. Okay, team, how are we feeling? Can everybody see my screen? You see the correct screen, Julia? Yeah, perfect. Okay, so Julia did it from her gym. I did it from the office. Hopefully, whether you're doing this at home or from your office, you can see that even a 15-minute little bit of exercise can make a big difference in your mood, how you feel. I wish I had remembered to say, turn on your videos, because I didn't get to see many faces, but I hope that you were enjoying and feeling like you could do some of those exercises, even if all of them didn't feel right. You maybe picked a couple out. And I'm actually going to flip back. This is what we did. If you have a phone, or if you're watching this on your computer and you want to take a picture, you might not, these are just the names. We didn't put pictures with it. But hopefully you can remember a wall angel, what that looks like, and a sit to stand. So version A is what Julia did. Version B is what I did. And these were the exercises we did today. So you can take a little snapshot of this screen if you'd like. And that's your 15-minute exercise routine that you can start to integrate into your day. So I love seeing the questions come in. I'm going to go through this last part in the next few minutes, and then we're going to open it up to questions. So let's talk about making it stick. So this is evidence-based behavior change strategies to get you started and to keep you going. Some of you on this screen tonight may be exercisers, you may be quite active already, and some of you maybe haven't built a routine yet, but today is going to be day one. You just did a little bit of an exercise workout. So how can we help you stick with it now? So we'll talk about some terms. Adoption is when you're starting a new health behavior. This doesn't necessarily just mean exercise. This could be changing how you're eating with your diet. This could be stopping smoking. This could be improving your sleep or well-being. This could be managing stress. But adoption is when you're starting a new behavior. Adherence is the ability to stick with the behavior. And when we talk about maintenance, that's usually when someone's been able to maintain a behavior for over 6 months. So that's our goal. Now, the road is always paved with challenges. So there's always things along the way that are going to get in our way when we're trying to make a behavior change. And so there's some evidence that shows different strategies that are actually effective to helping us stick with it. And we're going to talk about those. So the big thing, number one, is get educated. Learn about why it's important for you to do that new health behavior. Why is it important for you to stop smoking? Why is it important for you to be an active individual? We just talked about it in the first 25 minutes of the talk, so hopefully you're convinced. Why is it important for you to adopt a healthy diet? So educate yourself so you really know and you believe that this is an important change for you to make. The next thing is goals. So we'll talk about a strategy for goal setting, but you may have heard of SMART goals. So this is when we think about, my goal is to start exercising 3 times per week. It needs to be achievable. It needs to be manageable in your day-to-day life. I set goals regularly when it comes to my activity as well. And it's difficult. I have long clinic days some days, and my plan doesn't always go according to plan. But when I set my goal of X number of days per week, that's what I want to stick with. The next thing is self-monitoring. So how do we actually track our behaviors? And how do we actually see if we've been sticking with our goal? And so there's lots of different ways to self-monitor, and we'll talk about a couple of those strategies. Huge is social support. So do you have a friend, a family member, a spouse who you can set up a walk with once or twice a week, who you can do an at-home exercise program with? People who work out together are much more likely to be successful. This is the same. This goes for having, working with a personal trainer or a physiotherapist or your lymphedema specialist. When you meet them, you're more likely to actually do the exercises because you have a time that you're meeting someone. So that's social support, really important. Lots of evidence for that. Action planning. So this goes with goal setting. Once you set a goal, what's your action going to be? So I always like to say on Sunday night, or we'll do it Monday, because Monday's today. What's your plan going to be for the week? Get a calendar, write it down, and then track your progress. And finally, we're going to have barriers that come up. So what are the barriers? How did they get in your way? So I was going to do a workout after work today, and then my clinic went till 6:30. And so I didn't get the opportunity. So what am I going to do now? I'm going to have to change the time that I do it. Maybe my workout's not going to be as long after this talk, but it's something that I'm going to have to plan because my original plan didn't work. So how am I going to go about that? So find resources. What's available to you when you want to start being active? Do you have a gym nearby? Is there a space in your home? Can you use your office like I just did to do some exercise? What do you enjoy? That is huge. If you don't like to run and it doesn't feel right, don't start running. Think about what you enjoy. Do you like dancing? Do you like cycling? Do you like swimming? Do you like walking or hiking or rollerblading? What is it that you enjoy, and do that? Who can support you? We talked about. Establish goals that are reasonable within the next 3 months and then schedule it in. So just in the sake of time, I want some time for questions at the end. So this will be recorded and I'll provide these slides. So this is just a summary of SMART goals. So this allows you to be specific with your goals, and it gives you some questions. How are you going to measure if you've achieved your goals? Are your goals attainable? Are they relevant and realistic to what you want? Set a timely time frame. And then tell others about your goals so that you include them in it. This is a really key success trick, is tell others about what you want to do and get them to help you with it. Action planning we talked about. So I love to use this strategy that I'm going to show you on the next slide. And this is where we get a schedule and we actually plan out what we're going to do for the week. It's as simple as this. If you have a calendar, you can do it. Monday, I'm going to go for a 30-minute walk. Tuesday, I might do some stretching. Wednesday, I'm going to do a 30-minute walk and some strength exercises, my 15-minute strength workout we just did together. Thursday, I'm going to take a rest. Friday, I'm going to go for a hike with a friend that I've planned ahead. Okay, so build that out on Sunday or Monday, make a plan for the week, and then stick with it. Engage friends. So we talked about social support, the evidence around social support. When you exercise with others, you're much more likely to show up and to do what you plan to do. Okay. Now, common barriers that we all face: lack of time, lack of motivation, lack of social support. That lack of confidence is huge. Just feeling like I don't know what to do and where to start. And then feeling that there's this lack of ability in what you want to do. So how do you get started? These can all be common barriers that lots of people can face. And so how do we come up with strategies to work around this? And really the biggest strategy is to find things you enjoy and prefer. What type of exercise do you like? Do you like to work alone or in a group? We talked about the benefit of working with others, but some people like to do their activities alone. Where are you going to be active? Do you have dislikes or likes that you can kind of tailor in? So some people don't like doing resistance training, but they know it's good for them. And so they make some modifications. So they include a little bit of resistance training in. I'm going to finish off with 2 common myths that I think catch all of us up. Number 1, behavior change is easy. This is a myth. It's not easy. If you're going to start to become more active, this is what it's going to look like, right? There's going to be these barriers. You're going to have to go through a forest, ride a gondola, go through a boat, go over a bridge, and up a huge ladder. This is much more realistic than having your smooth path to being active. So just be aware of that when you go forward with your goals to be more active. And the other thing is that behavior changes fast. We are bombarded in the media with messages like this: 5 steps to lose weight quickly. This isn't reasonable and it's not realistic. And so it takes time to make really good lasting habits. And I'm going to end off on a slide like that. So motivation is what gets you started, but a habit is what keeps you going. And so I know that was a quick little summary, but I would love to jump into some of your questions. I'm going to provide all of you with a resource here. So I talked about how on the Thrive Health Services website, you can take a picture of this if you'd like, or just write down that website. We have a 90-page manual that goes through, actually, if any of you are familiar with the cardiac rehab manual or cardiac rehab program, we really modeled this after that great manual that you receive in the cardiac rehab program. And so we have different chapters on all different aspects of wellness. This is all evidence-based, and it really provides lots of tools and tricks to get active and get moving. And there's a whole chapter on behavior change that I just talked about. So it's free to download. More than 700 people have downloaded this, and it's provided in lots of different care centers across Calgary and Canada. So please feel free to download this and use it as a resource. And I think, I mean, I've already chatted about this with, I'm going to skip this slide, but this is one thing. If you're a healthcare provider, this is the paper that I had mentioned earlier. So here's the paper that you can download, the title. This was just an example I'd given in another talk about bone metastases. And so that's one of the other topics we cover. But again, it just highlights some of the things we talked about today in terms of lymphedema. So you're welcome to download that as well if you would find it useful in your practice. So I'm going to end off there and open it up to questions. I see we have 15 questions in the chat box, which is awesome. I'm going to pull up my email here and open the chat. And oh, awesome. I see Julia on here helping to answer some of these questions, which is great. And Julia also posted the website. When you go to the website, there's resources for professionals. Click on for survivors or thrivers. That will take you to all of the free resources. So go to that website under survivors or thrivers. Julia, maybe you can post the actual link to that. There we go. Perfect. She posted the link to the Thriver manual, which is great. So how about I jump into the questions on the chat? And then if people have questions that they want to ask as well, that would be great. So I'm going to just look to the top here and oh, amazing. There's lots coming in. Any questions, you're welcome to submit in the chat. Catherine's saying perfect. Oh, Catherine said you'll mediate questions at the end. I'm happy to go through them as well, unless you'd love to jump in, whatever you prefer.
I think either is fine. I noticed one just from Allison here. For those who do not have full wrist mobility, are there alternative exercises to the wall push-up, or should we just skip that exercise?
That is an excellent question. I wish I could see some of your faces. Let me just pull this up. There we go. Excellent question. So lots of different modifications for if you don't have full wrist mobility. That's actually a common thing that we see in our classes. One is that you get a pillow or you get a foam block, like a yoga foam block, and you put it so that it supports your wrist, if that's more comfortable for you, and kind of decreases that full extension of the wrist. So you just rest your arms on a pillow. If that doesn't work, then you can do other things. So you don't have to do a push-up against the wall. That's a closed chain exercise where we're connected to a wall, for example. You could do something else where you're actually getting a band, put it behind your back, hanging on to the band if your grip is okay, and actually pushing out in front of you and keeping that wrist nice and straight as you do that. So that might be actually better, but you're still getting the activation of your pec muscles into your chest for that full exercise. Julia, do you have any other ideas to add? No. Okay.
I think you covered it. And then just exploring other potential exercises. Like you could always try potentially a chest press with a band, or strengthening the other muscle groups around that also help you with those push type movements. But other than that, I think you covered it.
Awesome. I'm just seeing Denise wrote a comment as a retired home care therapist. I'm chuckling to see how many of these exercises are among my favorites to recommend to my patients. Yay! Awesome, including the sit to stand and angel exercises. That's awesome. I'm so glad to hear that. It makes me happy. And it makes me happy that healthcare providers are really promoting exercise and activity. That just is so wonderful. Good. Okay. Any particular time of day you recommend? You like the office demo and indicate that a little activity can be incorporated at any point in the day? Yes. I see you using a TheraBand. Resisted calf exercises was another favorite. Yes. So particular time of day, this is what comes into your preferences as well. Are you a morning exerciser? Do you like to wake up a little bit early, get it done and cross it off the list? Or do you like the extra few minutes to sleep in and you do it at the end of the day? Or do you have a lunch break where you can take 15 minutes and do an office or workout or get outside and go for a walk? So I would say it comes down to preferences. I know for myself, I'm not much of a morning person, but unless I do my workout in the morning, things like late clinics get in my way. And so I actually feel accomplished. I feel like it sets me up for the day when I set my alarm 30 minutes earlier and do a little at-home 20 or 30-minute workout. It works really well for me, but I had to definitely get into the routine of doing it. So find what works for you in terms of timing for sure. We talked about the wrist mobility one. Oh, awesome. You had answered this too. Thanks, Julia. Nancy, resources. Are rebounders okay for you to use? Yeah, Nancy, and specific exercises you shouldn't do, definitely. So that's really individual. And so it's difficult for us to give a general broad statement. I would say when you're starting an activity program, slow and progressive is key. Depending on if you have osteoarthritis, you have diabetes and you're checking your blood sugars, you have high blood pressure, all of those things that would impact how we tailor exercise, it might look a little bit different. But usually walking is an excellent way to start. And so increasing your walking in terms of intensity and volume, the number of minutes you do is a great way to start. In terms of resistance training, some of the exercises we went over today. So really kind of, I would say, getting that foundation down, nice, strong posture, engaged core. We didn't talk about much today, but really thinking about bracing that core so it's nice and strong, and then doing your exercises from there. In terms of avoiding high intensity exercise when you first start, it's probably not recommended. And high impact exercise for lots of people. If you're doing really high impact exercise, that can be hard on bones and joints sometimes. And maybe not the best thing for lymphedema when you're just starting. You want to go slow and progressive. And I would say don't jump into really heavy. We know heavy weights as you progress is okay, but not jumping into really heavy resistance. Start low and then progress as you can tolerate the weights. And rebounders. So if that's what you enjoy, that can be a great mode of exercise, as long as you notice it doesn't make, some of your symptoms worse. Some people find rebounders are fun. They help get your heart rate up and they help with that pumping action of the muscles for sure. So you have to find if it works for you, but there's lots of fun little rebounder classes, I think, that happen that you can get YouTube and things. YouTube exercises that you'd recommend. Yes. So Julia posted a YouTube link to our health and wellness lab run by Dr. Nicole Kulos-Reed, where I did my PhD and Julia is doing her PhD. Lots of videos on that website. So please go there and you can download and watch some videos. Exercise for leg, truncal, and head and neck lymphedema. So we didn't talk a lot about this today, but such a good question, excellent question. And I would say in terms of neck, I don't have specific, I'm actually working on the systematic review right now. A lot of the exercises were general body exercises. So core and posture, upper body exercises, and then range of motion for the neck. Those were the main ones that were done in some of these studies. I don't think we have a ton of evidence yet for specific head and neck strength or rehabilitation exercises when it comes to an exercise point of view, not a physiotherapy point of view. And then leg and truncal edema. So again, general exercise program we see works for this as well. Doing those leg exercises that pump those muscles, help get the fluid back into your central circulation. And then some of the exercises that you can actually do from a laying position if that works for you. So you help to work on that lymph drainage while strengthening. So maybe you're doing some core exercises or some hip strengthening exercises from a laying position or a hands and knees position, for example. And then as a private practitioner, are there specific physicians that are specialized to do diagnosis in lymphedema? So Francois, do you mean like lymphedema specialists who help with lymph drainage, or do you mean it specifically for exercise? Not totally sure. Oh, specific physicians. Yes. So I would say, I mean, your experts in that area are going to be lymphedema specialists, but for physicians, yeah. So usually, most physiatrists, rehab doctors who have cancer training. So I know there's only 5 of them in Canada, but you actually do specific training in lymphedema. It wouldn't be as in-depth as what you've done. So I actually have looked into doing my lymphedema therapist certification in addition to a fellowship, because most people don't get as much training. But I would say physiatrists with a cancer rehab focus, you do quite a bit of work with individuals with lymphedema during your fellowship training. Most people are fellowship trained at MD Anderson. So it's a huge, obviously you've maybe heard of MD Anderson, big cancer center and huge rehabilitation department. They have 8 cancer physiatrists there and a big lymphedema department. So you get lots of exposure during your fellowship training. And some people do their fellowship in Toronto, so a little bit less exposure. But I would say nobody will have as specific as you unless they've done their certified lymphedema specialist, which I think most of us should do if we go into cancer rehab, because it's just excellent. Yeah. Oh, in terms of diagnosing, so yes, you do learn about that in your fellowship, and then often we'll send to those of you who are certified lymphedema therapists, and physiotherapists often do the diagnosing as well and help with diagnosis and management too. Anyone else who wants to pop in and ask a question? Oh, yay. Oh, I'm so happy to hear that. Hopefully, I hear some people are writing in the chat that it's given them a bit of motivation. That makes me really happy. Julie and I are clapping just hearing that that a couple people are thinking about changing their routines a little bit and including more activity. Yoga, awesome. There's lots of evidence for yoga, actually. We do studies in our research lab with Dr. Kulots-Reed around yoga for general fitness and well-being after a cancer diagnosis. Yeah. Yes, smartwatches. So this is a way that lots of people track. You can track in your journal. You can track. I didn't talk about technology very much, but this is a great way. I double check at the end of the day, have my rings completed, which I don't yet. I have to get into my home gym. But this is a great way for lots of us to stay motivated and to track our progress through the week. Do I know of anyone studying exercise for lymphedema and yoga? So exercise for lymphedema, a big researcher in Alberta would be Dr. Margie McNeely, who's a physiotherapist, a lymphedema specialist, and has her PhD in exercise and cancer. She's out of Edmonton. She's fantastic. Yep, Julia just posted her name. She's doing active studies, and she actually is doing this big, we're all working together with a national group on this big review of lymphedema guidelines, which will include rehabilitation. There's a number of physios, lymphedema specialists working on it, and physicians as well. So she, and then yoga, I don't know if she's running any active yoga studies, but definitely you can look her up and see what some of her current studies are and what she's doing, but a big focus of hers is lymphedema. She has an expertise in head and neck cancer as well. So she doesn't just do breast associated lymphedema.
Wonderful.
Great questions.
Yeah. So if we don't have any more questions, I think they've slowed down here. I just once again want to thank you both, Julia and Dr. Capozzi. It's been wonderful to learn from you and to exercise with you. And I know that many of us are probably leaving feeling very motivated to get moving this evening. Diane, I saw that you just turned your camera on as well. Was there anything that you'd just like to say before we kind of close off our session? Oh, you're just on mute.
I just wanted to say thank you very much to both of you for this session, and I'm sure we'll get a few questions after this. I think it'll be from the primary lymphedema patients that it's not cancer related, because I think exercise for somebody that has leg lymphedema is a lot different than a breast cancer patient. I know that for me, I did dragon boating, and it did help my arm, believe me, to make it smaller. So exercise works, people. So if we get any questions, hopefully we'll be able to find them on your website. But again, thank you very much for this great session, and thank you for all of those that have joined us tonight. And I think that's, if there's no other questions, I can't see if there is because Catherine's taking that, but anyway, thank you, ladies.
Thank you very much. It was a pleasure, everyone. Really appreciate the thoughtful questions as well. Take care and thank you.
Okay.
Thanks, everybody.
You're welcome. Bye-bye.